My wife and I are expecting our first child, a boy, and I wanted some advice. We have read and researched, but I would like to ask other men how they feel about it. I am circumcised, and all the men in my family have been, but I am not sure about it. Any advice would be greatly appreciated. Story 1. My wife left the decision entirely to me. I decided against it since I see no reason to remove healthy tissue from a newborn unnecessarily. If he wants to undergo the procedure when he is older and can make the choice for himself, that is fine. At least the choice is his. Story 2. I'm cut, just like my 3 brothers. When our boys were born, my wife argued that cutting was barbaric, and I couldn't deny that. Our 2 boys are intact, and none of us ever regretted it. I mean, really, removing a piece of your child? When you think about it, it's crazy. Story 3. It is 2024. Leave 300 BC Jerusalem in the Middle East where it belongs. I am circumcised. I have no issue with it, but I would not circumcise a son. It is not necessary. Story 4. I am generally against mutilating healthy tissue without a medical reason. While some people believe it is cleaner, I cannot imagine anything filthier than placing an open wound in a diaper. Additionally, anesthetics cannot be used on newborns, so one of their first experiences on Earth would be pain equivalent to the sensation of ripping off a fingertip. Story 5. One of the things that made my dad so amazing was that even though he faced challenges, he wanted better for me. Story 6. Babies have fully functional pain systems but lack the ability to soothe themselves when injured. Consider how rubbing your elbow helps alleviate the pain after bumping it. Now imagine the sharp pain of being cut on the most sensitive part of your body, without warning, without the ability to self-soothe, and while being held by the ones you trust most. This situation may seem extreme, so there must be significant benefits to it, right? Story 7. That is barbaric. We do not regularly do that in the UK, thankfully. It is important to note that circumcision is sometimes performed in the UK, primarily among Muslim and West African populations. I did not consider that in my original comment. Story 8. Only some parts of the United States and extremely religious individuals seem to think this is appropriate. The rest of the world generally agrees that genital mutilation of babies is barbaric. Story 9. I am uncircumcised, so I do not plan to have it done to any future sons I may have unless there is a medical necessity. Story 10. The practice was popularized by Louis Sayre. Europe roughly has the same population as the United States. Almost none of the European men are circumcised, and there isn't any noticeable impact on men's health. If you don't subscribe to Louis Sayre's views, there are no reasons for you to do that to your son. Story 11. My suggestion is to ask a doctor who performs circumcisions if you can observe a procedure. If you prefer not to watch, I can explain what happens, as I have been a nurse who has assisted in circumcisions. Your son will be held down and may begin to cry. He will be fully awake and feel every sensation. The sides of the foreskin are clamped and pulled up and away from the penis. A cut is made in the skin to allow another device to be slid under the foreskin. This device covers the head of the penis, and then the doctor will cut a circle around the penis, removing the foreskin. The laceration will then be sutured to the skin of the shaft at the base of the head of the penis, and surgical glue may also be used. Some doctors use lidocaine for pain control, but many do not, and babies will feel pain. Consider how you would feel if someone cut skin from your testicle. After the procedure, babies can be given acetaminophen for pain at home, but not ibuprofen as they are too young for it. Parents must ensure the incision remains clean. Babies frequently soil their diapers, and if fecal matter or germs from a parent's hands enter the incision, it can lead to a severe infection very quickly. I have seen gangrenous tissue on a penis just a few days after circumcision. While it is not common, it can occur. In my personal opinion, the procedure is barbaric and serves no real purpose. It is extremely painful and involves many risks. If your son needs one in the future, it is performed in the operating room under general anesthesia, and children receive a dose of pain medications, which is a much more humane approach. Story 12. We asked the doctor for the advantages and disadvantages when our son was born. The only advantages to circumcision were a slight decrease in the risk of penile cancer religious reasons, which did not apply to us, and some fathers wanting their sons to look like them. None of those considerations were significant for us, so we decided not to proceed with the circumcision. If any of those factors matter to you more than the associated risks, feel free to go ahead. Penile cancer? What kind of world do we live in where such a condition exists? Story 13. Many decades ago, when my son was born, I was holding him in a waiting area before he was taken into the next room for the procedure. We were assured, they barely feel anything. Just as the nurse said this, a horrific scream came from the next room. I shielded my son from the nurse and said, "No way, that was that." Story 14. I'm uncircumcised and very happy about it. I have no standard to compare both sides, but I feel that circumcision should either be done when medically necessary or be a decision left to the child once they are old enough to make an informed choice, not something performed at birth that they cannot consent to. I've heard many circumcised men feel they are missing out because of it, and there are really no practical benefits. Just teach your son how to roll back the skin and clean early on so that he can desensitize the head, making cleaning less overstimulating. Story 15. I got circumcised at 22, and I regret it. It seems cruel to do it to a child. I'm surprised you can't sue over it in the United States. Story 16. My ex-husband and his oldest son were left intact without any issues. I grew up in a culture where it was common to have circumcision done. I couldn't find any reason to proceed with it, and when I discovered I was having a boy, my mother called me and urged me not to go through with it, as she had with my brother due to pressure from my grandmother. My son is now 6 years old, and we have had no problems. It is best to leave boys intact unless there is a medical necessity. Story 17. Absolutely barbaric and unnecessary. Cleanliness is not an issue. Please stop thinking that mutilating a child's anatomy makes it cleaner. Anyone who harms a baby's genitalia, in my opinion, should be jailed. Story 18. I was circumcised as a newborn. I don't regret it, but I don't think I will do it to my child. I am not religious, and I don't see a real reason to. Story 19. Please don't. You wouldn't cut off a baby's ear because it makes the head easier to clean and more hygienic, would you? The cleanliness argument is unreasonable since it takes 5 seconds to clean under the foreskin. Story 20. It's heartbreaking to think of the first few days of a child's life being clouded by the trauma of unnecessary surgery. Circumcision disregards a newborn's right to bodily autonomy and presents a painful introduction to the world when we should be nurturing them with comfort and security. It is our responsibility as adults to protect children, not subject them to outdated practices with questionable benefits. If it is not a decision made for crucial health reasons, then it is one that can wait until the individual can have a say in what happens to their own body. Story 21. Most of us outside the United States, which I assume you are from considering the question, do not understand this custom. Muslims and Jews may feel they must adhere to it, but for everyone else, you do not have the right to permanently alter another person's body simply because you feel like it. Story 22. Do not cut your kids. It is barbaric to find it reasonable to remove healthy flesh from a baby based on the beliefs of a group. Teach your kids how to clean themselves and assist them until they can manage it on their own if you believe it's a cleanliness issue. It's like having all your teeth removed because you can't be bothered to floss. If they want to join that particular group when they're old enough, it will be their choice. But if you do it when they're young, you make the decision for them and deny them autonomy over their own body. Additionally, most of the world doesn't practice that anymore, and we're doing just fine. I've had plenty of experiences with a naturally functioning body. No surgical procedure will be performed unless there is a medical necessity. Story 23. Why would you want to mutilate a baby boy who cannot even consent? Would you do the same if you had a girl? Explore resources for men who have realized the damage circumcision has done to them and how it affected their overall quality of life as they grew up. Story 24. I wouldn't proceed without a strong reason beyond the fact that others have done it before. I'm okay with being cut. My family was following the advice of their time. However, much of that has been disproven, and there isn't a compelling case for it now. Story 25. Medically unnecessary in nearly all cases, and even when it is necessary, it is still traumatic for a baby to undergo such a painful procedure. Additionally, many babies die from complications. If he truly wants to, he can have this done when he is old enough to make decisions about his own sexual health. Until then, there is no valid reason to choose it. Story 26. Genital mutilation should be punishable. Unless there is a valid medical reason for it, it should never be acceptable. Story 27. I'm uncircumcised and would prefer that I hadn't been. Don't get me wrong. I'm not bitter or angry at my parents, but I do oppose the procedure for those who haven't chosen it for themselves. It is far more invasive than it is made out to be and has significant, if not overwhelming, impacts on quality of life in adulthood. Put another way, how often do you hear about uncircumcised men wishing that they had been circumcised as babies or seeking the procedure in adulthood? Story 28. I did not circumcise my son because of his severe hemophilia, and I am happy to read all of these comments from men who believe it was the right decision. Not being a boy myself, I had no idea how this would affect him until now. Thank you. Story 29. I find it incomprehensible that this is still being debated. It is genital mutilation, pure and simple. We have long abandoned and criminalized this procedure on females, as it should be. While others argue that it is not the same, it cannot be debated that we are removing healthy tissue from a human being without their consent and without medical urgency. Religion and culture have long influenced each other, but this must come to an end. We have international efforts to suppress religion's influence on women's rights. This should receive equal attention and outrage. Story 30. My father is circumcised, but I am not. In 1972, this was not a common pattern. My parents told me when I was old enough that they believed it would increase my pleasure and there was no good reason to circumcise. I am grateful for their foresight. Story 31. Male genital mutilation should be the choice of the person undergoing the experience. This decision should not be made before the infant is able to communicate. It is not medically necessary in the vast majority of cases. It is important to teach your son how to clean his foreskin properly. Story 32. I was circumcised at 6 because I had phimosis. I believe a very low percentage of males suffer from this condition. It was quite painful. Do not perform this procedure if the boy is healthy. I think there is no other reason to do this except for phimosis. Story 33. There is a great essay by Michael Chabon, a Jewish author. He asks, isn't it my responsibility to stand between my son and religious fanatics with sharp instruments? We now know it is not necessary and may reduce future pleasure. For us, the question was whether to modify our son's body without his consent. He only has you to protect him right now. Be worthy of that trust now and for the rest of his life. Story 34. My mom fought against my dad to keep my brother and me uncircumcised, and I'm thankful for it. Sure, it's a little more maintenance, and childhood phimosis is something that has to be dealt with at some point, but the foreskin is very sensitive and I can't imagine sex without it. It also makes masturbation much easier and less messy. My mom never had to buy me hand lotion. I don't know if she ever considered it, but it could have been an awkward conversation at 14. Hey mom, can you grab some lotion at Costco for me? Please? Were you already through the last one? Awkward. Story 35. I am circumcised, and so are my brothers. The decision was made by my father a long time ago. He wanted us circumcised because he didn't want other boys to make fun of us in the shower after gym class. I suppose he witnessed some uncircumcised boy being teased in the late 1960s or early 1970s. I told him that if I were in the shower during gym class and kids were staring and making fun of my body, I would call them out for being overly focused on me or say their mother didn't mind my body last night. We should end the practice of circumcision unless it is medically necessary. Story 36. It is not necessary and can be harmful, potentially very harmful depending on the skill of the doctor. It seems pointless. The only reason I have heard for doing it is cleanliness. If we are focused on cleanliness, then we should consider cutting off our ears as well because they continuously produce earwax, which is not sterile. It seems irrational to remove body parts for the sake of being cleaner in the eyes of God and others. Please do not mutilate genitals. This practice often stems from religious beliefs and covenants with God, as mentioned in the Bible. It is not advisable. It is unwise. Story 37. Do not proceed. It is not worth the suffering the baby would experience. There is a lot of medical misinformation regarding its safety and effectiveness, which is generally overstated. If your baby has phimosis, it can be treated with steroid cream. Remember that poorly performed circumcisions do occur, which could result in the need for additional surgery in the future. Story 38. We believe that children's bodies should be respected and left alone. Other viewpoints are often rooted in personal beliefs and should be approached with caution. Story 39. There have been mistakes that resulted in the loss of the penis. Why risk it? There is no benefit and you lose some sensation. It was an attempt to prevent masturbation. It is not your penis. Do not cut anything off. Story 40. This is unacceptable. Unless there is a valid medical reason, such as phimosis, it is nothing but male genital mutilation. Story 41. Is that an option on the hospital forms? Why would any medical professional even consider harming a newborn child? Male or female? What backward, third world environment do you live in? Story 42. I believe in bodily autonomy, but my ex did not share the same view, and our son was circumcised. I am now remarried, and my husband is intact. As far as sexual preference is concerned, I much prefer an intact penis, provided he is careful about personal hygiene. Story 43. Do not do it. A small percentage of baby boys die from circumcision every year. It is not a published figure, but hospitals will not deny it if pressed. Why take the chance? Why expose your son to additional risk? Your baby might be one of the ones who does not make it. We have 4 boys, none of whom are circumcised. We left the decision up to them. They are in their 30s now. Not a single one of them decided to undergo the procedure. It was their decision. Story 44. What do you think about cutting off the tip of your newborn son's pinky finger? That is obviously horrible, and you would never do that. So why would you cut off part of his penis? Story 45. I had my son young and had him circumcised, which I have regretted since. We chose to do it because my parents had done it to me, and it was the norm among people we knew. In retrospect, that was a misguided reason to perform a procedure that is essentially genital mutilation on my baby. I would not do it again. Story 46. It is the sort of thing that unrefined, poorly educated individuals and cult followers in developing countries do. Story 47. It is one of the worst ideas humanity has ever conceived, and if extraterrestrials or artificial intelligence ever put us on trial for our actions and we have to prove that we do not deserve to be eliminated, it will be the prosecution's primary piece of evidence. Story 48. Circumcision of both boys and girls is completely barbaric and should never be performed. Most countries in the world understand this, and it is primarily the United States, Israel, and some extreme Muslim countries in the Middle East and Africa that still practice this abusive act in the name of religion. Story 49. Multiple responses have already pointed this out, but I will emphasize it. You would be making an irreversible alteration that he cannot consent to, which contributes very little to his life or health. If he wants it done, and if it becomes important to him later, he can choose to get it done when he is old enough to understand and desire it, and most importantly, ensure it is kept clean while it heals. Story 50. I think it's an outdated practice and essentially genital mutilation. I've heard the excuses. It's absurd to think we can't teach little boys how to clean themselves. I have also had debates with women who think men should do this for them. Now, first, it's strange to consider the sexual future of baby boys. Any woman who believes men should do this to be more appealing is misguided. If they feel that way, how would they like it if men insisted they trim their labia to be more appealing to men? Sounds improper, right? I say leave it to the child to decide for themselves when they get older. If they have health issues or whatever, they can make that choice themselves. But don't make that decision for them. Story 51. In my opinion, circumcision on a child should be illegal unless it is done for medical necessity. Religious reasons should not be considered. Freedom of religion should not apply because it is not your religious freedom to mutilate your child. It should be their own decision when they are old enough to make such choices. If you want to circumcise your child's penis for aesthetic reasons, then I question the rationale behind that choice. Story 52. I made a post about this before I had my son, 5 months ago. I am a woman who wanted the opinion of men. I felt like it was abuse and mutilation, but many people around me said rather strange and honestly disturbing things about why it was not a good idea. They mentioned concerns like him feeling left out in the boys' locker room or that girls would look at him weirdly. Why my husband's family thought that is beyond me. I still came here for advice, though, and literally every single commentator told me not to do it. Some were meaner than others, but I needed to hear that. Thank you all for reassuring me not to circumcise him. I'm not a man, but I don't think it should be done. It's cruel, unusual, and unnecessary. Doctors may argue that it prevents urinary tract infections, but it really doesn't. The only reason uncircumcised boys get urinary tract infections more than circumcised boys is that their parents feel too uncomfortable to talk to them about their own genitalia. So uncircumcised boys don't learn how to clean themselves properly. It has nothing to do with being circumcised, but rather with cleanliness and hygiene. The foreskin is supposed to be there. Imagine being new to the world. You're confused, scared, and overwhelmed, and then somebody cuts off a part of your genitals, leaving your most sensitive organ rubbing against the diaper for weeks until it becomes desensitized. Imagine what that would be like. I could not put my son through that. I heard horror stories about circumcision today. One commenter talked about how he heard a baby boy being circumcised in the other room and how wrenching that scream was from that little baby. Please don't do it. You wouldn't do it to a girl, so don't do it to a boy. Story 53. It is child abuse, and this perspective comes from someone who is circumcised. There is no need for it, as you are removing a part of the body that serves a purpose. It can lead to various issues, such as desensitization or oversensitivity, because the doctor may accidentally remove nerves or leave them exposed, causing overstimulation and potential pain during sexual activity. Some men may be fine, but many suffer consequences, including pain, an inability to orgasm, premature ejaculation, and in rare cases, infection and amputation. Do not proceed with it. It is wrong. Imagine cutting off a part of a woman's clitoris at birth. It is the same situation. People would be outraged by it. Story 54. I'm cut, but I would never do it if I had a son. The fact that they still do it is disgusting. Isn't it time that mutilating infants became a thing of the past? We all know better. Story 55. Was never necessary at baseline. It can be useful if a baby has something like hypospadias. During pediatric residency, we had one infant with a colostomy bag in the diaper area. After 2 urinary tract infections, it was deemed best to perform a circumcision so contaminants didn't stay under the foreskin. Medical students or first-year residents frequently participate, and they might cut off too much. Foreskin does not grow back, which can lead to painful erections or impotence. In the neonatal care unit, we had a baby with an undiagnosed bleeding disorder. After a simple circumcision, the neonatologist needed to manage the excess bleeding. I didn't participate in that case, so I don't know the outcome. I only saw a panicked father and a crying mother with 3 nurses around the bed while the neonatologist applied pressure. He told me to check on another patient, so I left. Whoever performed my circumcision cut off too much. If they had removed even 2 millimeters more, I wouldn't be able to achieve erections. As it is, I am obligated to use lubricant each time because the skin on the shaft does not move at all. Without it, it is too painful to continue. Do not perform circumcision unless it is necessary. The vast majority of the time, it is not necessary. Story 56. I believe it is sexual abuse. This practice was initially popularized by a religious fanatic who believed that masturbation was harmful and sought to reduce boys' sexual sensitivity. It gained traction in American society after World War I due to the number of soldiers who contracted infections in the trenches. I felt extremely offended and filled with rage at the societal pressure to prepare my son to be used as a weapon when he was only a few days old. It is barbaric. Story 57. I was a preemie, And for me, that doesn't hold significant meaning. I personally appreciate being unique and knowing that everything is in place. I was informed that it's mine, so I didn't ask many questions. You might perceive it as different, but it's his, and surprisingly, it requires very little intervention. Just remind him by age 12 to rinse underneath. There's minimal parenting involved. Story 58. I am circumcised, as was my father and my grandfather. My son is not circumcised. He is now 5 years old. You have to be meticulous about keeping them clean and in dry diapers when they are small. However, once they are out of diapers, it is straightforward and not much different from a circumcised boy. Once their foreskin begins to retract, usually around puberty, maintenance becomes different. Regardless, men have foreskins for a reason. They are naturally part of the body. Story 59. I have always thought about it from the baby's point of view. Ejected from a comfortable place into a confusing, bright world, wrapped in blankets and comforted, then, for no medically necessary reason, subjected to excruciating pain. Why? Story 60. It is horrifying for parents to allow such unnecessary mutilation to be carried out on their child. Story 61. Unless there is a real, valid medical need to do it at birth or shortly after, you should respect the child's bodily autonomy and let them decide when they are a legal adult. It's really that simple. At some point, someone was not circumcised and decided to do it. So the idea that everyone is circumcised is not a truly valid reason. There is a reason why circumcision has become an industry and why the rest of the world does not practice it, and does not have men dropping dead because they do not do it, misinformation and profit. Story 62. In my opinion, there are two reasons people have their children circumcised. 1. Religious beliefs. Cultural practices in the United States. There is no measurable benefit to circumcision, although some studies suggest it may reduce the risk of sexually transmitted diseases. A similar outcome can be achieved by practicing good hygiene. That said, do what feels right for you. Let others have their opinions. Story 63. I'm not cut, and trust me, I've heard there are many downsides to getting cut. I think it's pretty messed up. If he gets older and wants to do it, let him. Story 64. I believe anyone involved in it should face legal consequences, including parents, doctors performing the procedure, and the hospital being held liable, regardless of religious beliefs. It is genital mutilation. Story 65. Would you say that if you had a daughter born, you should have her clitoris cut off? Obviously not, as that is female genital mutilation. Yet you are asking if male genital mutilation is acceptable? What is wrong with Americans? Story 66. Isn't it genital mutilation? I had 3 brothers who underwent the procedure, and 2 of them ended up identifying as gay. I'm pretty sure my younger brother doesn't engage with partners as he doesn't want to use it. I remember him being in and out of the hospital because it didn't go right when I was younger. It got stuck a few times after he had the procedure. Can definitely damage a child. Story 67. I am completely against it. One point that hasn't been mentioned yet is that we need to consider his experience. He is an adult. Like it or not, most of the sexual stimulating nerves are in the foreskin. The foreskin has more nerve endings than the glands or sensitive tip of the penis, and its removal decreases sensitivity to touch. Men who choose to circumcise themselves later in life generally report a lack of orgasm intensity and quality, leading to a reduction in sexual satisfaction due to the constant comparison of before and after. There is often regret, but at least they can orient themselves around the religion they have chosen to follow. We cannot assume our children will have faith in the same way as these individuals, a demographic I have generalized. There are always exceptions. I know it is a sensitive topic when considering a baby, but it highlights another aspect of what could be deprived from their adult life. Story 68. My mother used to proudly declare at family dinners that I was not circumcised, and I'm glad my parents made that decision. There's no need for it. Story 69. If the first thing you want to do with a newborn baby is cut parts off them, you shouldn't be having children. Please, for the love of God, don't begin your journey as a parent by harming them. Story 70. As a circumcised man, I chose not to mutilate my son's genitals at birth. I find it bizarre and horrific that people continue to mutilate the genitals of young boys. Story 71. Baby genital mutilation is one of the worst concepts I have ever encountered. Additionally, indoctrinating your child with religious beliefs before they are capable of critical thinking is equally concerning. Please stop doing this. Allow your child to choose, when they are older, whether they want to be circumcised or participate in any religion. Story 72. You should not be slicing, puncturing, or otherwise mutilating someone else's body without their permission. Story 73. I feel strongly against it. Comes down to consent. In any other circumstance, we would all deem it heinous and inexcusable to take a functioning, healthy part of a person's body without their consent. The foreskin contains much of the sensitivity of the penis. When I orgasm, the earth quakes beneath me, and it is profound every time. It's time to lay to rest the myths about it being safer and cleaner. Story 74. There is no valid reason to cause pain to a baby simply because it is culturally accepted. Research why this practice became popular in the United States. It is disturbing. Story 75. Circumcision is a barbaric and outdated practice that serves no biological function. The only time it seems to have a purpose is when an individual is older and cannot retract the foreskin due to tightness. This is the only situation in which I believe circumcision may be justified. We do not cut off a baby girl's labia, so why would we remove a boy's foreskin? Story 76. My dad is from Europe, where it is not common, and I was not circumcised. I am happy about that. It is my body, and I would have resented it if someone had altered it without my consent. Story 77. Genital mutilation should not be performed at all. There are no real benefits to this practice. Foreskin serves a purpose. It should be left intact. Story 78. Genital mutilation is a form of child abuse. There is no medical need for it, and religious or cultural justifications are unacceptable. Story 79. Hi. I am an uncircumcised male living in the United States, where it is uncommon. I am glad my parents chose not to circumcise me, and I have experienced no negative reactions. Story 80. Aside from legitimate medical reasons, you should not be mutilating the genitals of your baby. It is a barbaric practice that should have been outlawed decades ago. Story 81. It is a form of genital mutilation and should be punished. If he wants it in the future, he can make that choice for himself. His body, his sexuality, his choice alone. Especially not the mother's. She does not have a penis and has no right to an opinion on someone's body. Story 82. It was never necessary. It can have religious significance if you are Jewish. Could be medically necessary later on, although the chances are incredibly low. It is done without anesthesia. Story 83. Unless there is a medical reason for it, such as the foreskin completely covering the glands and preventing the baby from urinating, then no. Circumcision is barbaric and there is no reason to perform it anymore. It is an unnecessary and outdated ritual. Story 84. If the argument for doing it is that it will be difficult to clean and may develop an unpleasant odor, the same applies to feet. Story 85. I believe it is better to leave the decision to the individual. I have a son whom I did not allow to be circumcised as a baby. He is now 10 years old, understands what circumcision is, and can choose for himself if and when he wants it done. Story 86. I believe it is mutilation without a valid reason. Unless medically necessary, which is rare, it should not be performed. I have heard a few people argue about cleanliness. In that case, teach your child how to properly wash themselves. Story 87. I would never cut anything off from my son. I am not from a culture where they do that. It sounds unreasonable. Story 88. There is no good reason for it. When do we cut away healthy, functional body parts in the name of tradition? That is called mutilation. Story 89. We chose not to proceed. There weren't enough compelling reasons to do so. The primary reason people provided was their own circumcision, which was not a sufficient justification for us. Story 90. I believe it is unreasonable to circumcise newborn boys for religious reasons. I think some of the Abrahamic faiths, such as Judaism, Christianity, and Islam, consider circumcision to be acceptable for religious purposes. For example, I recall reading that circumcision is a sign of the covenant between Abraham and God, which I find absurd, as I believe that Judaism, Christianity, and Islam are largely unscientific. The foreskin is a natural part of the male anatomy, containing many sensitive nerve endings. Circumcising a newborn boy can be viewed as a form of genital mutilation, performed without consent. I know men who regret being circumcised when they were infants. I believe circumcision should only be undertaken for significant medical reasons, and this is rarely the case. In the United States, it is common for followers of Abrahamic faiths to circumcise healthy newborn boys, even when it is not medically necessary. I would have been displeased if my parents had circumcised me without my consent. While some individuals do not mind being circumcised, the issue is that it is often unnecessary, and a healthy part of the anatomy is removed for trivial religious beliefs. Most men globally are uncircumcised. It is primarily in a few countries, such as the United States and the Philippines, where circumcision rates are high for newborn boys. In England, where I was born and have lived my entire life, it is uncommon to find circumcised men, except those circumcised for religious or specific non-religious reasons. The cultural perception of circumcision in the United States is quite unique. The argument that a circumcised penis is easier to clean is unfounded. I have an uncircumcised penis, and I find it easy to maintain cleanliness. Trust me, cleaning an uncircumcised penis in the shower is straightforward and simple. Story 91. If I ever have a son, I wouldn't do it. I don't need my son to look like his father, and I am confident that a person who is can still teach someone who isn't to care for themselves. It is an outdated tradition that has been followed for many reasons. I don't blame my parents for doing it to me, but with the information available to me, I wouldn't do the same to my child. Story 92. My husband is not circumcised, and it is my favorite thing in the world. It is so enjoyable to play with an intact penis. The way it moves and how you can slide the skin across the head to stimulate without making direct contact is so natural and fascinating. I honestly can't keep my hands off him after many years. Also, his pleasure and orgasms are just beautiful. I love how I can make him feel. During intimate moments, I enjoy pushing his foreskin up around the head, then slowly using my tongue and hearing him gasp. I can't imagine how I would interact with a circumcised penis. It would take away so much. Story 93. I disagree. The reasons given for medical advantages are minimal, with less than a 1% change. It is unnecessary and harmful to subject your child to pain just to conform. If you are not part of a religion that mandates it, there is no reason to put your child through this distress. Imagine having an open wound and experiencing intense pain every time you urinate, with a diaper constantly irritating the area. This is not acceptable. Story 94. A baby has no agency in this. In my opinion, if you are concerned about potential effects later in life, wait until the child is old enough to decide for themselves, and then allow it to be their decision. I believe that the average 7-year-old or younger will have no interest in the procedure. Story 95. If you had a newborn daughter, would you consider giving her a designer vagina? Would you alter her body to satisfy your own desires? Story 96. When my son was born, one of the doctors supported circumcision, while the other opposed it. I figured I was circumcised, so how bad could it be? I told them to go ahead and proceed. They took him into another room, performed the procedure, and brought him back. He was shivering and moaning for hours. He didn't cry out loud, he just shivered uncontrollably. I'm not sure I would make the same choice if I had another boy. I will never forget the sight of that helpless baby, whom I was completely unable to comfort. Story 97. Please provide an update with your decision. It is important to protect your child and their well-being. Story 98. I had to undergo a medical procedure, but most people can overcome phimosis with time. I didn't think I could, but at least I had the opportunity to make the decision when I was a teenager. Story 99. Please don't. I am circumcised and resent my parents for it. I have 2 sons, and I cannot imagine doing that to them. Story 100. It is medically unnecessary, and you should leave him intact. Just ensure that you wash him thoroughly and teach him to wash himself properly. Story 101. It is barbaric, denies boys the ability to consent, and is done for no valid reason. I find it completely indefensible in any civilized society. I cannot overstate my disapproval of circumcision at birth. Story 102. What is the reward for cutting off the foreskin? Is it cosmetic or does it improve function? There is no benefit to circumcision in these areas. Please do not circumcise. It is cruel, costly, and carries risks. Story 103. Consider this. If there were any evolutionary reason for us to not have the foreskin, we would not possess it today. Circumcision is unnecessary and inhumane. Story 104. Watch the episode of Penn and Teller's show about circumcision. Hearing the newborn baby scream as it is harmed will definitely make you reconsider doing it to your own child. It is chilling. Story 105. I didn't like it before, but after reading about certain religious priests abusing children, that settled it. If I ever have another son, he will remain intact no matter what. Story 106. No. It is his body. Leave the choice to him. If he wants to do it once he is old enough, then he can get it done. Story 107. Horrible, barbaric, pointless religious nonsense. The claim that it is more hygienic is not true. An uncut male is extremely easy to keep clean. Story 108. Dear Americans and religious people, stop mutilating your children at birth. This should not need explaining. Yours sincerely, the rest of the world. Story 109. I live in Ireland, where less than 1% of the population is circumcised. Only Jewish and Muslim individuals with strong religious beliefs typically undergo the procedure here. It is largely unnecessary and, once performed, can only be reversed with great difficulty. In this context, it is regarded almost the same as female genital mutilation. Allow your son to make the choice. Story 110. I dislike the double standard behind this issue. People are quick to cite my body, my choice when discussing abortion, but rarely mention it in relation to circumcision. Story 111. I did it to my son and regret it. It was emotionally traumatic for me and his mother. It is, in fact, genital mutilation. I strongly encourage you not to do it. The person can decide to do it later if they want to. Story 112. I was circumcised for medical reasons, and I still feel frustrated about it. I feel like my penis has been altered, and masturbation doesn't feel as good because I don't have skin on the shaft. The tip of my penis also feels somewhat insensitive. What's the point of undergoing this procedure without a valid reason? The operation is irreversible, and men may wonder years later what is wrong with their penis or if things would have been better otherwise. Story 113. I think it is barbaric, painful, and unnecessary. We are all horrified by female circumcision, but male circumcision is considered acceptable. I did not circumcise my son. He can choose to have it done as an adult if that is something he wants. Story 114. No, please don't. They will ask you multiple times in the hospital about it. Protect your little boy. Story 115. Don't cut it. It's a myth that it is cleaner after cutting it. It should be a decision that he makes when he is an adult. It is literally genital mutilation. Story 116. My boys are intact. They are 15 and 20, and there have been no issues. I couldn't justify the procedure when they cannot consent. I am a fourth-generation atheist, so I felt no religious pressure. Story 117. I used to think that if I had a son, it would be necessary for him to fit in or be attractive to future partners. There's a joke about uncircumcised individuals looking like a candy or a dog. I watched a documentary on circumcision and it was horrifying. They strap the baby onto a table, stimulate an erection, and then cut off the skin. It is genital mutilation, and I don't think any parent should have the right to subject an infant to that. My husband is uncircumcised, and I absolutely love his anatomy. It is beautiful. The foreskin helps preserve sensation and is useful during intimate moments. I recommend against circumcision. You just need to ensure proper hygiene by cleaning well and retracting the skin during cleaning, but otherwise it's not a big deal. I don't understand why people claim it's more hygienic. It's no different if you shower and wash properly. Story 118, don't do it. I am uncircumcised and happy and healthy. There are no negative side effects, either health-related or social. Story 119, I was against it, but my wife was for it. I was overruled, and our son got circumcised. If he resents it later, I will take responsibility. Story 120, I do not want my son to undergo unnecessary procedures, as I do not believe in genital mutilation, which seems to be a growing trend. Story 121. No, I am breaking the cycle. Most of my family thinks it's strange not to follow the norm, and my wife believes we should. I am having a boy, and I am firmly opposed to it. I could never forgive myself if something went wrong. Story 122. I am circumcised, but my two sons are not. There is absolutely no reason for it outside of a medical necessity or religious beliefs. The second reason is still debatable, but I will move on. Story 123. It is abuse. As a non-therapeutic elective body modification, it should only be done when the individual who has to live with the results and consequences can choose it for themselves. Story 124. Honestly, I wouldn't do it unless it's absolutely medically necessary. Even then, I've heard rumors that there are procedures that can address the medical problems without doing it entirely. I'm not a doctor, though. A qualified medical professional should always be consulted regarding medical issues. I believe the choice should ultimately be up to the individual when they reach adulthood. Story 125. Would you do that to your daughter? No, you wouldn't. Do not do that to your son. That is his naturally born body, the way it is intended. It was never necessary. Let's stop normalizing mutilation of babies. Story 126. My sister circumcised her son. The poor child developed a serious infection. I did not have the procedure done for my son, and he is fine. He is 15 now. Story 127. A surprisingly high number of circumcised men experience a distorted penis head or erection due to poorly performed circumcision. Do you want to risk this happening to your son? Story 128. Let me put it this way. Female circumcision is still practiced in certain parts of the world. It involves mutilating a child by cutting off a sensitive part of her anatomy in the name of preserving a barbaric, traumatizing, and misogynistic tradition. Would you consider doing that if you had a daughter? There is no legitimate reason to circumcise anyone. It is entirely possible to maintain basic hygiene to keep a foreskin clean. Sensitivity is also reduced on the tip due to friction from clothing. Additionally, I have a principled problem with allowing ancient, violent, and backwards traditions to dictate modern life. Story 129. Never, it's horribly traumatizing. Look up skin bridge botched circumcision. About 5 to 10% of circumcisions have problems. I have a skin bridge. Mine is the smallest and least intrusive one you will ever see. Only one of 30 or so women ever noticed it without me telling them about it. It's about 3 to 4 millimeters long, and if you don't believe me, message me. Some types of complications include skin bridge, glands damage, deep tissue damage, and healing malformations where skin attaches further up or down, creating tight bridges. Not to mention that the testicles will always be pulled up after every circumcision, which leads to desensitization from keratinization of the glands, and hair can travel the length of the shaft, making intimacy drier for your partner. Now what you lose out on. Studies approximate a 10-fold decrease in sensitivity to that area, especially the frenulum, a lack of moisture which is more comfortable for your partner from the glands and foreskin, and more. All circumcisions are extremely traumatic to infants, and studies show that it creates permanent pain pathway changes in the brains of infants. I am angry to have had the choice robbed from me. I've genuinely complained to my parents because both made the decision mindlessly. Story 130. Answer is no. Don't do it. Don't let your wife do it. Don't let your parents or other relatives do it. Don't let the medical staff in the hospital do it by accident. Just don't. Story 131. Leave the child intact. My biological mother didn't have it done at birth, and thankfully my adoptive parents postponed it, even though they often made life awkward by discussing my anatomy. I am very grateful I was left alone, and every partner I've had over the years seems to agree. Story 132. Don't do it. They don't give the baby anything more than a low dose of acetaminophen before removing the foreskin that is still attached like your fingernail is to the nail bed. It's torture. Story 133. I do not understand how you could think differently about baby girls. If you accept one form of genital mutilation, then you must accept the other. I do not agree with the reasons people give for circumcision. Teaching a child to clean themselves properly eliminates the need for such procedures. Story 134. I don't have any sons, but when my wife first became pregnant, she asked me if I would want to have a circumcision performed if it was a boy. I said absolutely not, unless medically advised by a doctor due to a specific issue. She had a different perspective based on how she was raised. I asked her if she would consider circumcising our daughter, and she firmly said no. I then asked her what the difference was, and that helped her understand my viewpoint. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.